Good afternoon, everybody. Welcome back. It's a crisp, cold day out today. A good day for more winter virology review with Gary Green here, which is, of course, what you're all living through in your offices. So, Gary, let's take off. We've got a lot of overlap going on still, don't we?
Yeah, it's hard not to present a lot of data and slides because of so much is going to happening. I must say, if you're a primary care actor right now, or an urgent care doc, or an ER doc, this is really a tough time. And I want to kind of put that in perspective. I want to give everyone an understanding on why is everything happening all at once. I want to show the first slide. This comes from a really good presentation I heard on Medscape. And this shows that there's a seasonality to most respiratory viruses. And that's what this shows. Don't memorize this, but it just kind of shows you at different times, different viruses come in and out during the winter season. And this is when you don't have public health measures. So if you don't have public health measures and kids are in school without a mask, you'll see this regular seasonality. But when you have public health measures, you kind of line the viruses up a little bit more. And that's kind of what's happened this year. So next slide, this comes from the University of Washington. So University of Washington was with the Public Health in Seattle, looked at different viruses in different seasons. And in this first slide, to the left, I'll show you that this was a normal flu season, and each separate color represents a different viruses. So all these viruses are circulating and peaking at different times. And then the pandemic hit, and there's that stay home order. Now, in the middle section, in this new middle section, I'll show you, this is what happens when you have that public health order. All of a sudden, all these viral rates come down. Now, when you lift the public health restrictions, then you see all of the viruses come back, but now they're coming back at the same time. And that's exactly what's happening now. So if you fast forward to where we are today, this is data from the California Department of Health. This shows you which viruses are circulating right now, and are they going up or are they going down? The first one, as you can see at the top, is enterovirus, rhinovirus. That's always here. That seasonality comes and goes, and it's because there's over 100 different subtypes of rhinovirus. So we never develop immunity to all the subtypes. But as you can see, that RSV has really been on the rise across the country, and hopefully it's plateaued right now. But RSV is running number 2 for the most prevalent virus in the area. Parainfluenza and influenza right now have matched. Parainfluenza's been up for a while, and influenza has come up to match it in the blue there. So influenza A is really what we're seeing right now circulating. Metapneumovirus, SARS-CoV-2, and adenoviruses are all on the rise as well. And I think on this slide, SARS-CoV-2 is being underreported because of so many home tests. But clearly, we're having this wide range of respiratory viruses all at the same time, and they're all going to peak about the same time. And that's what's really overwhelming doctors' offices, ER, and urgent care. And then if you're a parent right now, at least I've heard in Petaluma, there's been outbreaks of Coxsackie virus. So if all these respiratory viruses aren't enough, there's a little bit of Coxsackie virus that's peaking, especially in very young children, like the preschool age is the most vulnerable. So this is really a tough time, and I think that it's not over yet. Let's go back to the next slide. So this slide just represents people coming into the doctor's office. And this just shows you, if you're a primary care doctor, an urgent care doc, ER doc, what you're feeling right now. As you see that with the arrow, that's the influenza-like illness appointments being made to physicians' offices in California right now.
So, Gary, these are not diagnoses. This is a clinical syndrome. Just, you got a virus.
That's right. This is, you have a virus and you're calling your doctor. And as you can see, because of all these viruses are coming together at the same time, we're having a very early, 3 to 4 week early respiratory season in the flu season. And so this just puts a graph to what you're feeling in the primary care office right now.
The worrisome thing to me is to look where we're heading. Because we're pretty busy in the offices and we got a ways to go.
That's right. I think it's not over yet, and I think it's going to be not over for probably 2 to 3 weeks.
Okay.
Because we need to have a number of the viruses plateau and drop in order for the cumulative effect to kind of go down.
Okay.
So let's break it down a little bit. Next slide is the center slide for COVID-19. These are the positive COVID swabs coming to the lab. Clearly underrepresented. Even though it's underrepresented, we see an uptick in our COVID lab testing in our lab.
And recall, we've showed this same slide for the last 3 or 4 videos. It's been plateaued. We always talked about, hey, it's flat.
It's flat.
And now you see it's going up.
Right.
After Thanksgiving. It started before that, but it's really going up now.
Yeah, and it's still going to be going up.
Yeah.
NFL's not going to help that. You know.
Yeah.
This next slide represents kind of how influenza is across the country. So this is coming from the CDC. I just took this off today. And you can see California is a hot spot here. We're going to dial into that. Certainly right now in the influenza season, the CDC estimates 6.2 million illnesses, 53,000 hospitalization, and we're approaching 3,000 deaths so far this influenza season. The next slide comes from CDPH. This is the California Department of Health. This shows what's happening in California and the real high prevalence of influenza and the activities in the southern part of the state. But we're all headed to moderate illness. And I think you mentioned before, again, we're not done.
Yeah, we're just getting started.
Yeah, we're getting started with the flu season.
Yeah.
And so the yes is the best, the worst is yet to come. Now let me just give you, I'm gonna put in a box in the next slide, a little bit of data from California. 11% of our swabs are positive in California. We're gonna show some Santa Rosa data showing that that's higher here. 99.7% of all the cases are influenza A. The swabs coming back, and the vast majority of those are H3N2 influenza A. Hospitalization rates from flu stand at about 1%, 0.8%. There's been 17 deaths related to influenza in California. 5 of them are pediatric deaths. And the pediatric mortality is a good barometer of how virulent the influenza is this year. Sonoma County, 68 hospitalized patients. We've had 2 deaths in our county, and one of those is a pediatric death.
Gary, explain that. Is that 68 cumulative, or I mean, the hospital only holds 120?
No, I just talked to Dr. Mays this morning. We have 68 hospital patients right now in Sonoma County with influenza.
Okay, that's significant.
Yeah, our hospital, about 15 in our hospital right now. Okay. So this is data from Shared Lab.
This is the whole county.
Whole county, right,
Okay.
county
Thank
data,
you.
right.
Thank you. All right.
Yeah, so for our county, 68 hospitalizations, our hospital, about 15 patients. So this is data from Joan Etzel from the Shared Lab, and this is specific to Santa Rosa. So this is our hospital data. COVID-19, total about 6%, 5.9% of our flu swabs are coming back positive. And again, 6.7% pediatrics, adult about the same. Influenza, 31% positive swabs. That's enormous. So again, California in general is 11.6%. We're 3 times higher than the state's average. In children, kids under 18, 46% of our swabs are coming back positive. RSV positivity, 6.1% total and 15%. So almost 3 times higher in the pediatric cohort. Again, in our hospital right now, we have about 15 hospitalized with the flu. We have 2 adults hospitalized with RSV. And we'll talk a little bit about that in the next couple slides. So that's data for our kind of what's happening right here, right now.
Gary, before you move on, so we're seeing a lot of flu. 1/3 of the tests are positive. We just saw the line for COVID going directly up. So what is the prognosis for somebody who gets both at the same time? Is there much data on that out there yet? Gets COVID and the flu?
Well, the pediatric death we had in our county was influenza and RSV at the same time in a very healthy child. So yeah, I think that the combination of viral pathogens is probably less than 1%.
Yeah.
But less than 1% is significant. And so one of the good things about our testing in the hospital is that people are tested at the same time every admission, RSV, flu, and COVID. And so we're looking for co-infections, and we're seeing a smattering of COVID tests. I've had a couple of docs tell me, hey, I just had someone with COVID and influenza, you know? And so you may want to look for that for someone who's not getting better.
Okay, all right. So we don't have any real data to say how it's going to impact them long term. Obviously, having 2 is worse than having 1.
Right.
So we'll watch those people closely.
Yeah, we don't have, I see what you're asking.
Yeah.
We don't have cumulative data to say what's the mortality.
Yeah.
You know, if influenza mortality in a season is 0.1%, is it 2% now when you have co-pathogens? Yeah. And I think a lot of that's going to depend on the age and vaccination status. Yeah. So you can't vaccinate for RSV, but you can for flu. So unvaccinated flu with unvaccinated COVID, that's probably a pretty bad thing.
Okay.
Yeah. I'm going to show some data on RSV. This is a combination data on the next slide. We think that RSV has plateaued. Boy, I sure hope so, because our season came very early, very fast, and has pushed a lot of pediatric hospitals to surge there. And the burden of disease, and this is to the left, this represents data from 2014, 2.1 million outpatient visits for kids under 5. For RSV, 177,000 hospitalizations. for adults over 65 with RSV. That's a staggering number. And 14,000 deaths in people 65 and older with RSV. We've always thought about RSV as a pediatric disease.
Yeah, I mean, I practiced for 30 years and we never talked about RSV in adults. This is the first year I really recall seeing that it's in the newspaper.
Right, you want to ask, why is that?
Yeah.
It's because we haven't had good testing for it. One, we haven't tested for it, and two, the early antigen tests missed it. And so now we have PCR testing for RSV, and PCR testing is telling us, wow, there's more than we thought was there. And what does that play out in people who test negative for the flu that we thought, well, I'm not sure what that is, but now we know it's RSV. So the next slide is very interesting. This is an interesting slide that cut from CDPH. To the far right, this slide shows in California this year when people are hospitalized with RSV, what's the breakdown in age? And you can see that 3/4 of those are pediatric and 1/4 of those are adults. Now in the middle section, that's the ICU cases. So people get admitted to the hospital with RSV. How many go to the unit? The vast majority are children. And in the very left, who doesn't survive RSV? Kids survive RSV better than the very elderly. So it's the elderly that don't survive the RSV the most with children. And if you compare RSV and the flu, they're both pretty dangerous in cohorts of patients. We worry about the very young, we worry about the very old.
It's very interesting because a year ago, 2 years ago, an elderly person who had symptoms, negative flu test, we would have sent them home and said, you got a virus.
That's right.
And they could have this.
Yeah, and I'll tell you, the health department is actually watching closely now, not only for flu outbreaks in nursing homes, they're also watching for RSV outbreaks.
Okay.
There's something called the RSV Net, which is a national consortium of hospitals with the CDC and laboratories following RSV mortality, like we followed influenza.
Okay, great. Gary, thank you. Boy, that was a lot. I think, let me just give you a tip. If you're ever on Jeopardy, go for winter virology for 1,000. You just got schooled, folks. All right, I'm going to finish up with a few brief announcements. Those of you who were at our all-group meeting recently saw this, but it's important to realize the first slide is about our unusual payroll schedule in December. Remember, we get 24 paychecks a year, but we stack them up in December. So you see on the 10th, we get our usual payroll. We'll have an individual new special payroll on the 20th, which will be your year-end bonus. The usual payroll on the 26th, and then the extra payroll comes on December 30th. And folks, that's in lieu of the first one in January. So extra check in December, plan accordingly because your next paycheck comes January 26th. And next slide, just a reminder, please submit data. Our accountant is very busy and she'd like to spread her work out a little bit instead of getting all at the end of January. So submit your CME, your phone bills, your licensing, all those things. The right side of the slide talks about those of you whom have admin hours. You know who you are because you do that on terms. She would like you to get all that caught up, ideally in December, so you can get it on this year's profit and loss. And you can see that she wants it by December 23rd, so if you have a job that goes through the all December, just make some estimates about your hours and just submit that on the 23rd. And then the last thing I want to show you, again, for those of you who might not have been at our last all-group meeting, we had our annual shareholders meeting, which included an election. We had 3 seats on the board. 2 people were re-elected, and Dr. Bill Elder was selected to replace the retiring Jennifer Williams, so a new person on our board. Congratulations, Bill, and we'll see you Friday at our next board meeting.
And I'd like to say congratulations because you were voted in as president again.
Oh, yes.
That would have been important. Had that not happened, having you at the head of the ship is very important for us.
Thanks very much. All right, folks, that's all we got for today. Have a good evening.